Future nurses, HHS or DKA, which do you think is more deadly? By the end of this video, these two conditions will be crystal clear to you. So stay with me. And please don't forget to check out my master message flashcards that contain 11 body system and over 120 NCLEX most tested disorders or diseases. Now let's go. DKA, which is diabetes ketoacidosis, is the absence of or lack of insulin to shift blood sugar into the cell. Okay, and this leads to hyperglycemia. Now, in the absence of insulin to shift blood sugar into the cell, the body starts breaking down fats as fuel, and this results in ketones formation, which is a very acidic waste that will build up in the blood later and cause metabolic acidosis. Now, DKA is common in type 1 diabetes and in the younger populations. Okay, now let's go to HHS, which is also HHNS, hyperglycemic hyperosmolar non-ketotic syndrome. Now in HHS, there is little insulin to prevent ketones production, but the insulin is not enough to shift blood sugar into the cell. And this leads to hyperglycemia, severe hyperglycemia. And HHS is common in type 2 diabetes and in older population. Now let's talk about common triggers or causes of DKA. Number 1, infection or illness such as fever, flu, pneumonia, or even UTI. Okay, another one is major physical stress on the body such as surgery, trauma, myocardial infarction. Another trigger is missed insulin, skipping or not taking enough insulin to lower the blood glucose. Another cause is undiagnosed or uncontrolled diabetes, that is when the blood glucose or blood sugar is persistently high. This can lead to DKA. Now, common causes of HHS is also infection or illness or uncontrolled hyperglycemia. Also, uncontrolled or undiagnosed type 2 diabetes. Also, certain medication that raise blood glucose can cause HHS, such as steroids, beta blockers, phenytoin, and thiazides. Now, what are the signs and symptoms you will see in DKA? Dehydration, okay? Hyperglycemia, blood glucose usually between 250 to 500 plus. Ketones and fruity breath. And this occurs because the body breaks down fat as fuel. This will lead to ketones production. And the fruity breath smell is acetone escaping through the lungs. Now, cosmo respiration. This occurs because the body is trying to compensate. Because in DKA, there is ketones formation, which is acidic waste, and that builds up in the body and leads to metabolic acidosis. Now, because there's so much acid in the body is compensating through cosmo respiration, trying to quickly blow out CO2, the acid, and bring in oxygen. And that is when cosmo respiration comes in. The body is trying to compensate for the too much acid in the body. Okay, also you will see abdominal pain in DKA. Metabolic acidosis, okay, pH of 7.35 or less, because normal pH is 7.35 to 7.45. Signs and symptoms in HHS: severe hyperglycemia, blood sugar over 600, severe dehydration. In HHS, you will see neuro symptoms such as confusion, NCLEX tested. When you get a question about hyperglycemia, a patient having hyperglycemia with confusion, that is HHS. Now, in HHS, there is no abdominal pain, there is no ketones. Just like I said, there is little insulin to shift some sugar into the cell, and that will prevent ketones production because the body is not breaking down fat as fuel. The body is actually using glucose, but the insulin is not enough to shift all the blood glucose into the cell. So that is why there is no ketones in HHS, and there is stable potassium in HHS. Okay, now treatment for DKA. Number 1, our priority in DKA is fluid volume resuscitation to prevent circulatory collapse because of severe dehydration. So the number 1 treatment is 0.9 normal saline to correct the dehydration. And the next treatment is insulin, okay? IV regular insulin only to lower the blood glucose, and hourly blood sugar check must be done. Also, 5% dextrose in water can be added while the insulin is still running to prevent hypoglycemia. While the insulin is still trying to get rid of the ketones to prevent hypoglycemia, IV dextrose can be added to prevent hypoglycemia, especially if the blood glucose is lower than 200. Okay, and the last treatment is to add potassium while insulin is still running, because insulin will shift sugar and potassium into the cell. So to prevent hypokalemia, you need to add potassium, even when the potassium is normal, 3.5 to 5. But in order to prevent future hypokalemia, while insulin is still running, you need to add potassium, okay? Lastly, you have to keep monitoring the blood glucose, the potassium, and also blood pressure, and that completes DKA. Now for the treatment in HHS, just like DKA, the first treatment in HHS is also fluid volume resuscitation. Just like DKA, the first intervention or treatment in HHS is also fluid volume resuscitation to correct dehydration, which is 0.9 normal saline. Also, IV insulin is used to lower the blood glucose steadily. And remember, only IV regular insulin and hourly blood sugar must be monitored. Lastly, don't forget to assess patients' LOC or neuro symptoms such as confusion if it has resolved. Okay, and these are the key difference between DKA and HHS. Now, no more confusion about them. Go ace that exam.